Welcome to the Taking Care of Tutu podcast. I'm your host, Meg Ovenov. Today, we're happy to have Jessica Acop. She's a nurse and she's the Maui Memorial Medical Center Program Director for Wound Care. Welcome, Jessica. Thanks so much for coming on.
Thank you for having me today.
So, tell me a little bit about your background and how you came to be in the position that you're in.
Yeah, so I've been a nurse for over 20 years, and my background is really trauma and emergency room. And I've practiced mostly in the mainland and in Texas. But I was brought into the wound care clinic when we first opened. So we actually opened this clinic in 2022, late 2022. Um, and right now we're bringing services that we haven't had in this island before, which is, of course, your advanced wound care services. And we also have a hyperbaric chamber here. We actually have two. So we brought the first hyperbaric chambers in the island to service our community.
I want to hear a lot more about that. That's really interesting. I want to first ask you, why do you think they felt the need to start this wound care program in 2022? Like, what
Yeah,
was the need in the community?
so, as we all know, most of our community members have diabetes. Our population is very at risk for it. I'm Filipino, so by our diet, we are predisposed almost to diabetes. This is also true with your Japanese population and, of course, our Hawaiian population. So, we have a greater population here in Hawaii that's affected by diabetes. And so with diabetes comes, of course, wounds, because most of our diabetic patients cannot feel anything on their feet. And so if they eventually develop wounds, initially they don't see it. And so these fester and become what we call chronic.
I
Um,
can also imagine that maybe they would see it, but they can't reach their feet to provide first aid for themselves.
Yes, that's also
Okay.
true. Or they'll see it and they say, "Oh, it's just a small cut."
Yes.
And then we leave it alone for a little bit. It's really out of mind, because it's on the bottom of your feet sometimes. And
Right.
then by 2 years, we didn't realize, "Oh, 2 years has gone by, my wound is still there." So
Oh my gosh. Really?
yeah.
Two
Mhm.
years?
Yes.
Oh my
We
gosh.
have patients who have had wounds for 30 years.
I wanted to have you keep talking about the process where someone would come in and maybe the physician would need to debrief the wound and then they would continue to come in each week.
Yes. So most of our patients, we love our patients here and they love us. It's actually a great way to get to know your patients. This is very unique to wound care because our
Mhm.
patients come every week versus in other clinics, you come once a year, you come twice a year.
Yeah.
Here in the wound care clinic, we get to know our patients from head to foot. We get to
Mhm.
know their family, their entire history. So they come every week to see the physician. Most of the time, we have to debride the wound. We also have wound care products that are advanced. So these are not just your gauze and a cream. We use other things like hydrophobia or calcium alginate or silver or collagen. We put collagen in your wound, see if that works. And then you could get to come the next week and your wound is smaller, then we'll continue it. We also have advanced products like skin substitutes, for example. So we can apply skin substitutes that are sterilized that come normally from placenta tissue or from umbilical cord tissue. We will put that on a chronic wound to kind of trigger again your growth factors. Because there is a reason why your wound is not healing. Normally, it's because either your diabetes is out of control, you have
Mm.
inflammation there, you have an infection. So what we do here is we actually narrow it down and see, why is your wound not healing? Is it because of infection? Is it because of your diabetes? Is it because the plumbing is not working, meaning your uh, vascular isn't working? So we figure out what is going on, and then we treat it that way. We just don't look at the patient and say, hey, there's a hole on your leg. We actually look at your diet. We even look at your A1C for diabetic patients to see if your A1C is less than 7 or more
Sorry, can
than
you
7.
say what A1C is?
So your A1C is a measurement of your sugar or your blood glucose over a period of time. Um, and this is mostly measured by a blood draw. So it's called your hemoglobin A1C. So it measures kind of like the level of your sugar over 3 months. So for example, I'm diabetic and I wasn't good with, eating. Most of the time, bad A1C is from 6.5 and above. Um, and that's the issue with our diabetics. Most of the time, they haven't been really good with their diet or their lifestyle. And so sugar, when it's stored in your body, as if I'm diabetic and my sugar's not being used as fuel by my body, it actually rusts your body.
What are some warning signs for like particular wounds that people should not ignore?
So warning signs is, of course, a wound that does not heal. Um, in For me, the metric is, if your wound is not healing in 7 days, you
Okay.
need to see a physician.
Okay.
Um, any redness that spreads, any bad odor, pus coming out of the wound. Sometimes you don't even have a wound and your feet is turning black or gray. You need to see a doctor right away. So
Ooh.
technically, anything that's not healing over 7 days, for diabetics, it's not. If you get a wound, go see your podiatrist right away.
What steps can people with diabetes take to try to prevent foot wounds?
So I would say the number one thing is to change your diet. Uh, Because if you're able to keep your hemoglobin A1C, again, very important, um, very low, you'll be able to actually help your body heal the wound faster, right? So that's number one, is diet and lifestyle changes. And then, of course, we always encourage our patients to look at their feet every night. So look at the bottom of their feet, make it into a nightly routine, see if there's any cuts on their feet. Also, especially in between your toes, make sure you look at it on a nightly basis. If you do that, you won't be able to a wound that's on the bottom of your foot that you can't see, it won't be able to fester. Because the most horrible thing that can happen is amputation. I don't think I even looked at the numbers, but every day in our country, you have 229 people die from complications of diabetes. 356 people on a daily basis in our country get amputated.
And so I heard you started saying people watch movies. Like, how long is the typical stay in the hyperbaric chamber?
It's an hour and a half.
Okay.
You get to come every day. So if you're one of our HBO patients, you are here Monday to Friday.
Wow.
Yeah, it's a commitment for sure. But
Yeah.
initially, some patients are reluctant to start. But when they start it, they actually can't get enough of it. They'll ask the doctor if they can have more, So
Because are there like, do they also feel good because they have all that
yeah,
oxygen running around?
yeah,
So in addition to
yeah.
their wounds getting healed, they also feel amazing.
Yes, we
It's
have
funny.
some patients that report to us, I sleep better now, or my COVID brain fog is gone. But we're not diving them for that indication. But we get a lot of stories because they feel so much better, they sleep better, their cough is gone, their mental fog is gone.